Good afternoon, everyone. I'm Governor John Carney. Welcome to our weekly press conference on Delaware's response to COVID-19. We've been doing these conferences now for over 3 months. We've got a format with a presentation that we'll run through, talk about some of the positive cases that we're seeing, the testing program. I'm joined by Dr. Karyl, the Director of the Division of Public Health. She and her team continue to do outstanding work. She's got some information to present today that is important. Some of what we're seeing in the field and correction to some of the data that have been presented over the last several weeks that don't really impact our decision making on a day-to-day basis, but was an effort by the division to go back and kind of audit the information that we've been presenting. And so that results in restating the number of total deaths. Sadly, those individuals who were COVID-19 positive who passed away and are added to our death toll as of today. We also have some observations, some of which is anecdotal, about what we're seeing in the public in terms of letting our guard down a little bit with respect to protective measures, social distancing, mask wearing in particular. As I travel around into retail establishments and watch youth sports activities, practices, Little League, some of the junior football leagues that are starting to practice without paying a lot of attention to social distancing and mask wearing. And we just need to emphasize those important measures that we all need to be taking in order to protect the spread of the virus in our community in the short and long term. There's been a high price that's been paid, particularly in the business and economic sector, by individuals and business owners, organizations with respect to lost revenue because of the shutdowns. And now it would be a shame to now have to moderate or change the direction in which we're going because folks have gotten complacent and not taking protective measures. We know the science is very clear that the virus still exists in our community. There are people who are still tested and are COVID-19 positive, and if you're exposed to it, you're likely to get it as well, the virus, and spread it to others. We've been able to push down the curve there and limit its spread so that it's not spreading exponentially, meaning in a way that's out of control. And so we need to be, all of us, attentive to actions that we can take to protect ourselves and our neighbors, our family members, and most importantly, vulnerable citizens. So let's take a look at the numbers. Overall, we're closing in on 11,000 positive cases across our state. A.J. Schall, who is heading up our testing, the point person of our testing effort now, has really ramped up the number of tests that we're doing over the last several weeks. Thousands of tests. We're testing more people that are asymptomatic, I think, that are symptomatic.
Absolutely.
So the percent positive rate is below 5% in most cases, which is a good thing. And so we're seeing some good news there. But we do see here an uptick in the number of current hospitalizations, which is a little bit concerning. We're going to keep our eye on that number. It had dipped down into the high 70s a couple of days ago before the weekend, and then had some hospitalizations over the weekend that drove the number up to 91. Still comfortably below our ability, our hospital capacity to treat COVID-19 patients, but concerning in terms of the existence and the severity of the virus in our communities. So almost 4,700 positive cases in Newcastle County. They're evening up with Kent County, which had the most cases for the longest period in time. Newcastle County now has more positive cases at 4,700 than the other two counties. 1,600 in Kent County, which is fairly consistent throughout as a percentage of the total, and then 4,500 in Sussex County. Really, things are are leveling off in Sussex County. We had a conference call with the hospitals earlier today and got a very positive report from Dr. Tam at BB in terms of the number of hospitalizations there, and as well with Bay Health, which has hospitals in Dover and in Milford. And so good news from downstate for the bulk of the last 2 months, really. The number of the outbreak that we had among poultry workers in Sussex County was one of our biggest concerns. The cases, you can see there's a little bit of a shift here, and we'll talk about this. It's something that's occurring here in Delaware, as well as other states across the country that are experiencing increases in the number of positive cases. On our White House call yesterday, we had reports from the governors of Florida, Texas, Georgia, and Arizona about the increase in number of positive cases in each of those states, and they talked about some of the explanations, mostly anecdotal, about where it's coming from. But clearly, individuals in the 18 to 34 year-old age group is where many of these cases in these other states, according to their governors, there's where the increases are coming from. And so the average age of positive cases in those states is closer to 30 and 35 than it was in the mid-50s, to say 2 months ago. And we're seeing a little bit of that here. And I think it's indicative, again, anecdotally, of behavior. Young people eager to get back outside and back to the beaches and inside to restaurants and the bars that might be connected to them, or beach houses and parties. We'll talk a little bit about that. And just the emphasis on the fact that the virus still exists in our community, and that these large gatherings, in particular gatherings, where people are not able to keep 6 feet apart. And obviously, if you're in a party down at the beach house, that's probably not something that you're paying a lot of attention to, or certainly wearing a face mask. And so we're seeing an uptick there in the number of positive cases in that 18 to 34 age group. Again, our dashboard for personal protective equipment, all glass fully full. We're in pretty good shape there across the board. AJ, if you want to comment on that.
So yeah, the only thing we're hearing from our healthcare partners is they are seeing a longer delay coming back into the orders they've had. So not unexpected. For several weeks there, we were in a region of hotspots. So I think we had shipments that were prioritized to Delaware. Now, as we've moved in the right direction, I think stuff is getting prioritized to other areas across the country. So the supply chain, as much as it's recovered to some extent, it's still not back where it was pre-pandemic stages. So we're still keeping an eye on this very closely to make sure we're ready for any recurrences necessary.
So a little bit of a difficulty with the supply chain.
Yes.
Because some of these other states are experiencing more of an uptick than we are.
Absolutely.
So we obviously need personal protective equipment in order to just, do our normal business in primary care facilities, hospitals, essential businesses, any business which has employees that are kind of on the front lines, very public facing, and of course our hospitals and other healthcare providers are just that. So here's the data dashboard. You can see again the trend, and there at the end of the trend, starting there around Friday, June 19th, June 20th, an uptick in the number of hospitalizations. I did talk to our hospitals earlier today, and it was their view that this uptick is nothing to be too concerned about, although it's a blip that we're going to keep our eye on. It does, we are seeing an increase in the number of positive cases. The percent positive is staying pretty good number, right around 4% at the high on the June 22nd date there. There was that blip in mid-June. You can see the blue bars on the top far right represent the moving average, and so you can see it's a pretty consistent percent positive below 4%, which is where we'd like to see it. It is increasing a little bit. And again, our focus is on the last little uptick in hospitalizations and number of positive cases over the weekend, and we'll be paying attention to that, particularly as we make decisions relative to phase 3. We're well into phase 2 now, and there have been some observations of activity in phase 2 that give us some concern about folks not wearing face masks as protection, indoor gatherings in particular, and social distancing, folks being a little less concerned about that. This is not the time to let our guard down, not the time to be complacent. In fact, it's really a time to cash in all those investments in the health of our community so that we could have a healthy economy. You can see here in the data dashboards, everything was moving down pretty consistently in the right direction, with the little uptick that provides some concern in combination with what we see on the ground in public to again communicate a message of caution, of personal responsibility, of thinking about our neighbor and acting accordingly. If you look at the 90-day view, very good picture of the dramatic, almost exponential growth in the number of positive cases, the number of hospitalizations, which obviously is a measure of the severity of those positive cases, peaking there at the end of April, the beginning of May, and then a consistent improvement over the last really month and a half, 2 months, with respect to the number of hospitalization admissions day to day, the percent positives, which was up close to 40%, over 40% on a day-to-day basis in mid-April, and increasingly declined after that to where it is today. Now we're doing a lot more testing today, and we're testing asymptomatic individuals, and so you would expect that to happen, but that's a pretty good number and certainly where we want to be. I would emphasize, though, with everybody, that's important to get tested, whether you have symptoms or not, flu-like symptoms or not. We have a lot more test sites, and we're not getting quite the interest that we expected. AJ, maybe you'll comment on that. But we need folks to come out and get tested, particularly if they think they've been in an environment, maybe at the beach or at a large gathering or whatever the case may be, at a graduation party that's concerning. We encourage you to get testing, because the way we're going to control the spread of the virus now is testing both symptomatic and asymptomatic, people that don't have symptoms, to have a better idea of the spread, to get early on, identify people that are COVID-19 positive, and then to test people that they've come in contact with through, interviews and contact tracing, which we are standing up. One of the observations made by, I think it was the governor of Florida, with respect to their experience with the increased number of cases there, was that about half of those tested were asymptomatic. And so I think you're going to see, I think the data and the science suggests, Dr. Rattay can comment on this, that kind of the younger you are, the less likely you are to be symptomatic, right? And to be carrying the virus, shedding the virus, if you will, without symptoms. And obviously that's a big concern and a reason that we're emphasizing that everyone should be tested, whether they have flu-like symptoms or not. So the last slide that I have, again, shows the percent of person who tested positive back over time, going back to the stay-at-home order, which was in the end of March, and moving through the out-of-state quarantine on March the 30th, at the end of March, after we had closed the beaches and restaurants after St. Patrick's Day. Then the requirement for face coverings. You'll remember that the advice from CDC on face coverings has changed a little bit through this pandemic. It was not as definitively recommending using them back 2 or 3 months ago, but consistently now the strong recommendation is that a very strong protective measure is to wear face masks when in public, certainly when in indoor establishments where there are other folks, if it's difficult to social distancing. So you can see our rolling reopening, which started in early May and continues now through mid-June into phase 2. So the bottom line message is we need everyone to act with a sense of responsibility and community and awareness of the fact that your actions affect your neighbor and vice versa. And so wear a mask when in public, wear a mask when you're at the grocery store, wear a mask when you're at your son or grandson's or brother or sister's athletic, youth athletic event. Show by wearing a mask that you're concerned about your neighbor, that you're concerned about the community health, and that you want our economy to be strong. So wear a mask, and then secondly, keep your distances from those, your 6-foot radius from those outside of your household. Just be cognizant of how close you are to people, recognizing that you could catch the virus from them through respiratory droplets and vice versa. Make sure you get tested on a kind of regular basis, and certainly if you've been in an environment where you might have been exposed to those that were COVID-19 positive. So that's the message. We see a little bit of an uptick. We're going to keep our eye on it. 2 or 3 days of data trend doesn't create, but we'll be watching it. We're moving through the phases, a little bit concerned about folks not observing social distancing and face wearing when in public. Be respectful, be responsible, think about your neighbor, wear a face covering, and we'll be in good shape. So with that, I'm going to turn it over to Dr. Rattay. And again, thank you, Dr. Rattay, for your good work and the work of everybody at Department of Health and Social Services, and particularly your team at Public Health as we move into this really important new phase where we're maintaining the health of our community while making our economy stronger again.
Great, thank you, Governor. I have a few items I'm going to touch on today. First, we're going to talk a little bit about Senior Beach Week and COVID exposures at Senior Beach Week. So, general principles, this isn't new news, but as Governor Carney was just saying, and you're going to hear continuously over and over from us, what increases your risks of either spreading or being exposed to COVID-19 include how close you are to people, so social distancing, which includes, how long you interact with people and how many people you interact with. So again, social distancing, critical. Whether or not you wear a face covering is obviously extremely important. And also, as we continue to learn about this virus, there is a much higher risk of being indoors as opposed to outdoors. So I think many of you have seen some of the coverage around Senior Week positive cases. We became aware of some positive cases in one house last week. 4 individuals in one rental unit became positive. 3 individuals in another rental unit now have tested positive, and there's another unrelated case who also attended Beach Week activities. We expect that to go up as more testing is done. So really key points here. If you are mingling with strangers in large group gatherings, you are putting yourself at risk. Now, you can decrease that risk, of course, by wearing a face covering and social distancing. But again, if you are mingling with strangers in large group gatherings, especially indoors, or if you are living in a group setting with several other people, especially who are not your direct family, that's also a risk. And if you participated in Senior Week activities, we are saying that that is a risk as well. We're not saying that anybody's in trouble for participating in Senior Week activities. What's important from our perspective is we need to understand the facts. We need to know who's positive, who was exposed, so we can decrease the spread of infection. And I think that's also extremely important for anyone involved to think about grandparents and others who will be exposed. We know related to Senior Week activities are also graduation parties. And one reason we felt it was really important to raise awareness around this is because we know at graduation parties, grandparents and other vulnerable individuals spend time with their loved ones, their seniors. And for obvious reasons, we really want to protect our vulnerable populations. So getting tested really is so very important. And as Governor Carney was saying, a lot of folks in this age group who are positive don't have symptoms. So waiting for symptoms is not going to tell you that you should be tested. If you participated in Senior Week activities, please go to de.gov/COVID testing to get more information about the testing locations. So the next item I want to touch base on is complaint and enforcement strategies. So Governor Carney mentioned this. We all have seen it with our own eyes in multiple settings, but we also have received, a number of complaints about a lot of different settings in which social distancing or face covering guidance is not being followed. A number of businesses, gyms, restaurants, bars, youth sports, and more, where we know many are doing everything they can to do what is right, but we also know of a number of examples where, again, social distancing and face covering guidance is not being covered, or social distancing and masking guidance is not being followed. And therefore, DPH, the Division of Public Health, and the Division of Small Business are working together on an enhanced enforcement strategy. This is really important that we do all we can to help businesses make sure that they've got the right guidance in place. DPH, our Health System Protection Section, is going to be, or continue to be, the centralized point of contact for managing complaints. This office already oversees the Office of Food Protection, pools, personal care like hair salons, tattoo, etc. So it makes logical sense that this is the office that receives complaints for other businesses that we don't normally regulate, and perform not only announced but also unannounced inspections to better understand how the guidance is being followed in these places. So some of the things that we're looking for is, first of all, are inspectors allowed to come in? Second, is signage appropriate and visible? And again, from our perspective, the most important things are face coverings and social distancing. So are staff and patrons wearing face coverings as is recommended? Are social distancing guidance being enforced, which includes our visual cues for distancing in place? Is line management taking place? Are people, 6 feet apart in line? And are the capacity limits being addressed? Also, does the business have a written plan around the guidance for that specific business? So when we find out about, when we get complaints or concerns, the first thing that we always want to do is find out more information and educate. So oftentimes it's just making sure that people have a good awareness of what is expected of them. But we also, depending on the situation, may immediately go to do an inspection or may follow up with an inspection. Closures could even happen, as well as referral to law enforcement if needed. So if anyone has concerns about any businesses not following the guidance, it's really important for you to just let us know by contacting hspcontact@delaware.gov. Then we can follow up, educate, and hopefully get all of our business sector in line to help protect Delawareans. I also want to touch base on a data issues the governor was mentioning. You may very well have noticed a pretty significant increase in our total death counts today. First of all, very, very important to mention, these are not new deaths. These are deaths that have occurred from the very beginning of this pandemic. Deaths involving a reportable disease like COVID-19 are required to be reported to DPH in two ways. They're to be reported to DPH epidemiologists, as well as for those physicians who enter the information into a death certificate, they're also supposed to put the information in the death certificate. And what we have done is we learned of another state that identified that they were missing some information where cases or deaths weren't being reported to them. So our team took a look at the death certificate information, and we identified 67 additional deaths that were not previously reported to us. So among those 67, 32 were cases that we had in our system that we knew were positive. We just did not know that the person was deceased. So those were confirmed cases that were added to the system. And then there were also 35 individuals for which there is no positive lab results for COVID-19, yet the physician who put the information into the death certificate used COVID-19 as an underlying cause of death. Therefore, by CDC definition, those cases are also considered COVID-19 deaths. Because those 35 don't have a positive lab result in our system, they are considered probable COVID-19 deaths. So again, you will see an increase in our death numbers today. It was part of our quality control practice. We felt we needed to be proactive and make sure that our data quality is as good as it can be. And so that's why you see that increase. Now, among those 67, 75% of the decedents died in long-term care facilities. 85% had come from long-term care facilities, but 75% died in long-term care facilities and were not reported to DPH. So DPH is now reaching out to the facilities or organizations that did not report this information to make sure that they are fully aware that they need to be reporting deaths to DPH. But we're also now, as part of our data quality process, looking at our death certificates on a weekly basis going forward to make sure that we're keeping up with any cases that may not have been reported to us. And finally, I want to provide an update on our contact tracing program. We are extremely excited that we are going to be doing a soft launch of the contact tracing system on Friday, and it will be going fully live over the weekend, which is very exciting. I have to give a huge shout out to James Collins and Greg Lane from DTI, Robin Burris, and Molly McGarrick, and Dr. Walker, and a number of other people, including our epidemiologist, HMA, NORC, and Innovational for the most amazingly quick work I have ever seen to stand up a data platform. One thing that we want to make sure that you are aware of is that as we're transitioning from our current data system of REDCap to the new system on Salesforce, you may find that for Friday, there may not be updates in our data report. So the data may be delayed by 24 hours or so while we're making that transition. We don't want people to be concerned. We just want you to be aware that you may not see data updates on Friday. It is possible it may be longer than that if there are any issues or concerns, and we'll make sure that we find other ways to keep people updated on our numbers. And with that, I'm going to hand it back to you, Governor.
Yeah, thank you, Dr. Rattay, and thank you to your employees there at the Division of Public Health for their due diligence on the death reporting and for going back with the audit to just confirm those numbers. Sadly, additional deaths that are being reported and attributed to COVID-19 illness. A special thanks and recognition, as you say, to the DTI team and the public health team on the new contact tracing program system. Really a short order and an implementation that has gone well so far on a very short period of time. Lots of good work went into it. I think these data systems are among the more difficult things that governments, business enterprises do all the time, and particularly when you have to do it quickly and it's mission critical as this one is. And so hats off and thanks to all the DTI folks and all of the technical people that had a hand in that project. AJ, I know a lot's been going on with respect to testing. You've been our point person for that, ramping up in a significant way. Why don't you let us know how things are going, and kind of, I know we want to encourage people to get tested, pay attention to the testing sites. They do change from day to day or week to week, and it's important that we have participation and cooperation among the public as well.
No, absolutely, and I think I'll cover multiple points that you just made as we go through this. But to give everybody just a snapshot of where we are for month to date, so as of the end of business day on Monday, we were at about 34,000 tests across the state. So we wanted to make sure about early May, we said we wanted to have the capacity to test about 80,000 people a month. We're not going to hit that number this month, but we definitely have that capacity. We have sites that have had vacancies in them still to be tested, so we are not turning people away, and if we are, we're making sure we capture them in a testing site close by. So 34,000, as you see the rates per 10,000 people in the population on the My Healthy Communities page, you see that kind of what was very blotchy about a month ago is a little bit more consistent now. Still have some areas that are underrepresented, and we're doing our best to try and get out there in the community to get those individuals to be tested if they want to. We've been using multiple means of communication, reverse 911, social media, the Facebook page, and I'm going to actually expand on that over the next few weeks to include some other ways to make sure we get that messaging out. I'm going to close with that as well. Here's just a snapshot. Might be a little difficult to see online, but we've had over 60 testing sites during the month of June, from Claymont down to Lewis and Rehoboth, and all the way down into southwestern Sussex County. All these dots represent at least one site. Sometimes we've had more than one at some of these communities, so trying to get around the state as much as possible. If you go to the next slide, you'll see kind of where we have this week. So this is just about 15 to 17 sites that we'll have between now and Saturday. Again, concentrating in Dover today, we had a very good day down in Dover, Modern Maturity Center. We had about 500 people. We were at a church down there with a few hundred people. So we are trying to get into the community in very creative ways, using churches and other groups to really help us spread the message of the importance of being tested. So if you want to go to the website that I know the governor and Dr. Rattay already mentioned, de.gov /COVID testing, you will see the full list of testing that's out there. So what's on this map right here is only the drive-through saliva-based testing sites that the state is participating with assistance from Newcastle County up north. This does not include sites that the hospitals are still doing in some communities that they have found the need for. So Nanticoke, BB, Christiana and St. Francis are still doing sites with some of their partners. This is specific to the drive-through sites that you could sign up for. And again, we will talk about our path forward at the end of the next few slides. So again, all this information is online. Another 10 sites this week in Newcastle County. Thank you to the county executive and his team for providing the personnel needed to make these work so we could concentrate other parts of the state. Kent and Sussex, again, you'll see multiple sites. What we are doing to kind of tag team with Dr. Rattay was saying about the concern down with Senior Week is we're doing our best to get this Rehoboth Beach testing that we have this Thursday out to the hospitality industry, knowing that there's restaurants and hotel workers and people that work on the boardwalk, and we want to make sure that they know that, hey, this is in your backyard, please go get tested. It's this big site. Will be able to process 1,000 people if they sign up for it. So the more that register, the more tests we'll bring with us. And then really, what's the next step? So we've been talking about testing now since March, and for a long time, it was if you don't have a fever, if you don't have shortness of breath, and you're not going to the hospital, you're probably not going to get tested. You need a doctor's note. Now we want everybody to get tested. And I think we need to make sure that message is getting out there very clear and concise, that if you want to get tested, if you've been potentially exposed to somebody, some of the factors that Dr. Rattay went through, sign up, go get tested. You know your status. As we have loosened the restrictions, gatherings are coming back little by little. We want to make sure we limit our risk where we can, and part of that is making sure people get tested when they've maybe been around other people. We're also looking for neighborhood solutions. So probably during early July, you're going to see us from doing the road show to identifying static locations in each county and kind of rotate. So every Monday will be one place. Every Tuesday we'll be at another one or two places. So we'll have multiple sites a day, but we want to get in that community. We want people to know exactly where we'll be, when we'll be there, and kind of blanket it that way instead of being very reactive to how we've been to date, to try and get that low-hanging fruit as many people as we can. And lastly, the business community. As we've gone through this reopening and relaxation of requirements, we're working with the Division of Small Business and Public Health. We'll be presenting to some of the roundtables next week about ideas that we have to engage the business community. A lot of that's communication. We know that there's going to be all these testing sites. We want to make sure that we identify what works for different businesses. We also want to make sure the high risk and medium risk industries that Dr. Rattay identified in her plan for employers about a month ago have access to testing, whether it's something they're doing directly with a hospital or a commercial lab, or it's something that they're teaming up with public health to do. We know we need to do this to make sure we keep people safe and have a path forward to make sure we keep those numbers that we looked at in the beginning on the declining trend. So with that, Governor, back to you. But again, we want people to be tested. Go to the website. We have approximately 20 different sites a week that we'll be facilitating for the short term, and as we go on, we're going to find other ways to even get a bigger foundation throughout the state.
So great job, AJ, you and your partners, more so now, the state and community partners than the hospitals, as was the case in the first 2 or 3 months. Great partners there with the hospitals. They're still doing testing, not in the community level, some in the community level. That's not exactly accurate. But you've got, it looks like 10 sites in Newcastle County and 8 or more sites in Kent and Sussex County coming up. The message is pretty clear. Get tested, get tested, get tested. Because we need to know the extent of the spread. We need to know where it is. We need to nip it in the bud. We're going to manage the spread by testing and then isolating those who test positive, and then doing some tracking on people they've come in contact with. So testing is an important part of it. The other part is prevention, wearing your mask, keeping social distance, be careful in public settings in particular. Limit your public circulation to a certain extent will be helpful as well. And when you're in a restaurant, wear your mask before you're eating. I know that's not a requirement, but it's advisable. We need to think about ways to protect the health of the community, so we really can get focused on helping businesses get revenue and be strong again. And so all these things, testing, contact tracing, wearing masks, physical distancing. If you think about just those things, wearing my mask and making sure I'm conscious of who is next to me, whether I'm in the gym, where I'm at the Little League game, whether I'm on the beach or on the boardwalk. I'm thinking about my community. I'm thinking about my neighbor. I'm being smart. I'm getting tested. I'm washing my hands. I'm doing all the things that will help us cash in all the investment that's been made in the health of the community over the last 3 months. We've seen this little uptick. We're going to keep our eye on it. We're going to focus on it as we think about changes to phase 2. We're pretty much, largely open with many of the restrictions of 3 months ago having been lifted. I was at the beach to look at the beach, the boardwalk, and the restaurants. Traffic was heavy, and I understand continues to be. And while that's a good thing, it also is concerning if folks aren't following the public health guidance. And it's really just that simple message. It's not the heavy hand of the government. It's really the helping hand of a neighbor that says, well, we're all in this together. Let's make sure we protect one another by wearing masks, by being careful, by thinking about how separate and apart I am from those near me, whether I'm in a restaurant, whether I'm in the grocery store, whatever the case may be. So again, thank you to you, AJ, and your teams there doing the testing, all our community partners in Sussex County and Kent County. A lot of the churches have been involved in that, as you say. A lot of community organizations really leaning into it. We do rely on the public, though, to come out and be tested, focus on. I know it's not maybe top of the mind if you're not symptomatic, but we need to have broad-based testing of folks that are symptomatic and those are not. Again, just to reiterate the experience of those 12 other states that have seen really significant increases in their positive cases, it tends to be in environments that aren't as disciplined with respect to social distancing and mask wearing, and that can create a problem, and that'll set us back, and we don't want to get set back here. So with that, appreciate the media for attending again and your presence. I think we have one member that's here in person, then we have a number of questions that have been submitted in advance.
Appreciate your time.
Yeah,
Chief
thanks for
Owens,
coming.
Delaware Business Times. Got two different kind of sets of questions. One, since I'm hearing about some of the data auditing you guys have been doing lately, I'm wondering any other concerns about the accuracy that the data the state is relying upon. We've asked some questions to DPH and DHSS regarding hospitalization data fluctuating a little bit from day to day.
Yeah, that is a concern, right? It's always a concern when you have small numbers, and that's been a concern from the beginning. You'll probably remember that we didn't follow exactly the advice of the CDC, which called for a 14-day decline in the number of positive cases, and for good reason. The testing we were doing was not consistent day to day, and the results came back in different intervals of time. At one point, when things were really tight in the private laboratories, it could be 10 days before we were getting results back. And so it was very uneven. And so we really then we came up with a 5-day moving average to smooth some of that out on the cases side, but really started focusing on hospitalizations, which are real. We know what they are every single day, because people in the hospitals go and they count them. They know the severity. They know where they're on a ventilator. So that's real data, and it's up to date by day. And that was really that 14-day interval of decline that we were looking for. If you go back and you reconstruct the graphs, you see a nice little kind of academic epidemiologist, case for the dramatic exponential increase, the peaking, and then the decline. We did see some flattening of that curve, I think. I'd like to believe that, actually. So now, yeah, so we, on the hospital call this morning, my question is, help me understand what we're seeing. Are we, and their response was, and of course I'm sure they hadn't talked to anybody in the emergency room so far today, but it's not out of the ordinary. But it is concerning because we know of the senior week issue. We've seen some of the parties. We know we've opened up youth sports. I've seen myself how the coaches and the parents aren't following the guidance in terms of dugouts and spacing and that. We need to work with that, and we're going to do that. Get more people on the ground. We're gonna talk to the people in the league. Some leagues are better than others. You know, we've had tournaments over the weekend, which are a big concern, and we're going to do a lot of, Monday morning quarterbacking on that. But yeah, everything's a concern now because we don't want to go backwards. Right. And particularly with folks that read your publication that are so focused on
Sure.
economic and business activity, we want to go forward, not backwards.
And so just so I'm understanding clearly on the auditing that you guys did do on the deaths data, then that was referring specifically to classifications on death certificates and trying to align them. So it wasn't necessarily a computer error or something where you weren't capturing all the data. It was more of a classification error.
Not so much a classification error. The deaths were not reported to us as is required.
Okay.
So when a death occurs, we're supposed to directly get a report to our DPH epidemiology section. And so in our goal of ensuring that our data is as high of quality as possible, we cross-checked, we looked at death certificates and realized that there were a number of cases that had not been reported to us. And so we dug in deep to better understand those cases, and that's why they're being added now, even though they are deaths that have occurred, over time since March.
Sure. Different subject, Governor. I was hoping you could expound a little bit on the resignation last week of Health Secretary Walker. What was the timing behind that? Was that something where she came to you and told you that she was considering leaving the administration before the pandemic, or was this something that came up recently?
Well, first of all, she's been great. She just was a godsend from the beginning in terms of her leadership, her expertise as a physician, family physician, doing work in population health, all her focus on healthcare costs, and really helped us kind of move our engagement on healthcare issues forward from a physician's point of view, right? And just a delightful woman with incredible grace and great leadership. And, there are a lot of factors that came into play. She had some family issues with her father, who, by the way, worked with my dad, who's passed many, many years ago, as life would have it, and particularly in our small state of Delaware. Didn't know it when we appointed her, when I nominated her to the position. I didn't find out till sometime after that, and so it was that, and then just incredible opportunity with Nemours, an incredible organization and a leadership position. I know it was a very difficult decision for her. And she stayed. We wanted her to lead us through I guess the really hard part. Sure. Although it all seems hard to me. This part, I say to folks, is harder. The reopening is harder than the closing down. But she's just been a godsend to us, and we're going to miss her.
So this was something she was considering perhaps before the pandemic really got started, or was this something that...
It's been something that she had made me aware of.
Sure.
Some time ago. I probably should let her answer that to you. Sure. Instead of that. But she did stay longer than okay. As long as we could convince her to stay.
That was going to be my question. Was there any conversation about trying to delay her resignation?
Yes. Well, I tried to talk her into staying indefinitely, but it was a set of personal circumstances and
sure.
and a professional opportunity that she really couldn't turn down.
And then just kind of on the same lines, I was just wondering, as we speak right now, your Deputy Secretary, Molly McGarrick, is having her confirmation hearing. I know that there are some in the minority party here that have some questions about her qualifications. Any response to that? Did you consider any other candidates, or was Molly the only candidate?
Well, first of all, she was Dr. Walker's recommendation as her Deputy Secretary. I know Molly from when she graduated from college. One of the things that you learn as governor, particularly going through experiences like this unprecedented one, expertise is really important. But trust is even more important. And Molly is somebody that I trust implicitly, that I know her heart, I know her mind, I know her in a deep kind of way as a professional and as a person. And I just think she's uniquely suited for this very difficult job. In terms of credentials, I like to brag about the fact that she's about to get a master's degree in healthcare from Dartmouth College, which is about as high a measure for me as a Dartmouth undergrad. Well, I think Molly do a great job. Legitimate for members of the Senate in their confirmation to ask her tough questions, particularly given the circumstances in which we find herself. I think she'll pass that test with flying colors. She's got great physician support. That is absolutely critically important in that division or that department. It's a much bigger department than just the public health side, right. With expertise that I know she will utilize and provide the leadership that we need that's based in the values that are important to me.
About 26 other states have chosen to put doctors into that role, and was it imperative for you, considering maybe some of the other people on as a part of that administration she could depend upon, or was there any decision-making in terms of whether or not, obviously Karyl was, to replace Karyl with another doctor?
Well, when I first talked to Dr. Walker, and she said that she thought Molly would be the best, and I know Molly as I do, that was kind of all I needed. Obviously, various positions. I remember when I was nominated to be Secretary of Finance, a lot of people questioned whether I had the ability to be, and I didn't ask the Governor Carper at the time if I could be the secretary because I didn't have a degree in economics or that. But when I found out who else was being considered, I said, I could do as good a job or better than this person. I just know the kind of job, the kind of worker that she is, what she brings to the table, and I have every confidence that that obviously she's just not an MD. There are plenty of MDs there that can help her with that part of it.
Thank you.
Mm-hmm.
All right, this question is from Susan Canfor at Coastal Point. Are the Delaware Division of Public Health and Governor's Office concerned about a second wave of the coronavirus, as there's some fear this will happen in the fall? What plans are being made in case there is a resurgence?
Yeah, I'm very concerned about a resurgence, both now, as we get into the summer and we've reopened. We've talked a lot about, most of what we've talked about at this press briefing is concerns about a resurgence and complacency with respect to protective measures. So we're going to focus on that and be cognizant about what all the public health experts in CDC and NIH tell us about the fear of a resurgence in the fall with the return of the flu. And that's why we've put together the Pandemic Resurgence Advisory Committee with 3 separate subgroups on business, on health, and equity. We know we've learned a lot over the last 3 or 4 months about COVID-19 and its challenges, who's most at risk and what we need to focus on. And these professionals that are part of each of the subcommittees will provide us with a roadmap going forward. Dr. Rattay, I think from a public health perspective, this is a concern, right?
Absolutely, it's a concern. It's a concern also because the wintertime is influenza season as well. And so considering, influenza and COVID-19 together from a health system capacity perspective is concerning. Our health system in Delaware, I think already in the last few months of working with them, we know that they are prepared and they know how to surge and they know how to enhance their capacity. But certainly it is a concern, and glad that the governor has created the Resurgence Advisory committee to really look at all the issues, learn from our last 3 months, and do all we can to prepare for what we think could be even much more significant viral activity in the wintertime.
So to one of those points, and that is the hospital capacity, we only, at the worst, AJ, we only got about half of, right, about our surge capacity. So we did learn that we did have capacity beyond this particular pandemic.
No, we did. I think so. Some of our assumptions that were gray probably back in March and April, I think we have a better
Untested.
foundation
Right.
right now to understand. However, it's still going to be, a lot of public, discipline and flexibility that we're going to need to make it through this.
This question is from Amy Cherry at WDEL. Like the Senior Week teens, have you been able to identify any clusters of protesters who have tested positive for COVID-19?
Yeah, not to my knowledge. We have gotten the word out to have protesters who were close together in large gatherings to get tested. I don't know if we have any evidence of that yet or not.
Yeah, we don't have any evidence here in Delaware, and in fact, on Friday I was speaking with colleagues across the nation, it's not to say that there aren't cases of protesters who are positive, but because these are largely outdoor events and in general good face covering compliance, we think that may be a big reason why we're not seeing a resurgence. And again, from a scientific perspective, that's really helpful to us to understand, where we're seeing spreader events and where we're not. But outdoors really seems to make a huge difference.
We didn't get much compliance on social distancing, but on mask wearing, there was a lot of mask wearing.
And then we had several questions about the Senior Week teens who were exposed to COVID. Was there a concern that, do you think short-term rentals were allowed too early?
Yeah, we got a lot of complaints that we didn't allow them early enough, and some complaints that we allowed them too early, so maybe we hit it right. I don't know whether that's a connection. Obviously, I think there was a connection between the parties and short-term rentals. I think the real, if they weren't in short-term rentals, they probably would have been in private, homes. And the issue there really is the protective measures and behavior, lack of social distancing in larger groups, and particularly with folks that may have not been in the same, group or neighborhood from other, areas. I don't know, Dr. Rattay, you have?
Yeah, that's exactly right. I mean, we're not suggesting from this experience that people don't go rent a home in the beach. What we really want to emphasize is that the protective measures they're just so important. So the face coverings, the social distancing, if there is a gathering, do it outside and do it just where people are distanced and face covering. Put those things together, we're much more likely to decrease spread of infection.
And I think the other key thing that we've learned through all that is you can have somebody who's asymptomatic who's shedding the virus. So nobody might feel sick among the large group, but somebody in there is positive, shedding the virus, doesn't know it, and others are catching it. That's a troublesome learning that we've had over the last several months.
The next question's from Matt Biddle at Delaware State News. What will the governor do in regard to reopening if Delaware keeps seeing positive trends, but the situation keeps worsening in many other states? And then we had several questions from the other end. If Delaware sees a major increase in cases, what will you do in terms of putting restrictions back in place during the pandemic?
Yeah, well, I think we'll have to take it a day at a time and determine what the trend looks like. Again, the focus now is on significant widespread testing, identifying cases early, isolating, and then testing people they came in contact with. It's not broad-based, blunt instrument shutdowns and isolating the whole community. That's not the approach. So we do have to to work on contact tracing and the effectiveness of that. And every state in the nation has to do that as well. We do have to work on our messaging. We do have to work, I think, now on enforcement. We're seeing things out there, and we need to have people going and at first reminding, you can't have this. We can't have this. We did that at the beginning with large retailers, and we called up the Walmarts of the world and others and said, hey, look, this isn't going to work. We're going to have to close you down. Same thing with construction. We never closed construction down in Delaware, unlike what they did in Pennsylvania and New Jersey. But they policed themselves to a certain extent. Now, we're going to have to get out there, I think, and do more of that. I think we're going to see more of that. Reminders, gentle reminders, and then, maybe like cease and desist orders if folks continued to ignore it. Because the idea of shutting down again, well, that'll always be, something that you can use, but it's a very destructive, blunt instrument. And we need to do these other things and protect or perfect these other mechanisms first.
This next question is from Sean Green at WDEL. Several states, including New Jersey, Pennsylvania, and Ohio, have recently announced plans on restarting high school sports summer training. What would you need to see for schools to be allowed to commence summer training?
Boy, that's a hard question. And it's particularly hard, again, anecdotally. I don't know whether Phillies or Philly fans saw that our Philadelphia Phillies had to close their spring, summer training camp because they had players that tested positive and staff. Clemson football team had 20-some players test positive. And I know I talked to Dr. Asanis at the University of Delaware this morning. He's heading up, he's our point person on a regional group looking at it. They've invited some of their athletes back to campus to work out. I just think if you think about football in particular, which I'm a big football fan, I just don't know how you do it in a way that's safe. There are other people who are looking at that question. We'll continue to look at it with respect to youth sports. I think our eyes on the ground, enforcement, guidance with that, starting with the little leagues that are getting started here. High school athletes, I think I have a nephew that plays, as many people know, with the Minnesota Vikings. They're talking about starting their season without fans. Which is hard to imagine with piped-in crowd noises and whatever. But, it's a very serious, the worst scenarios, I think, are these large gatherings that are uncontrolled with respect to social distancing and with respect to mask wearing. And so sports activities does create huge concerns, particularly if fans are involved.
I can add just
Sure.
one point of clarification. We have been working with the DIAA, and so the guidance that we released about 10 days ago for youth sports, they are developing their own set of regulations to be consistent with or to align with the guidance and the order that Governor Carney signed. There's a lot of unknowns, but there are things that they can do at this point. So football players, may be able to train at this point, socially distanced, but they're not going to be able to make contact.
I like the idea of a 6-foot radius around me if I was playing basketball, though. I think I'd be a much better player offensively if I had that much room.
The next question is from Cassie Semyon at WBOC. Does the governor have a comment on the question, if the governor can open boardwalks without restrictions, why can't farmers markets be open without restrictions?
Well, my understanding is the restrictions are the same. So I'm not sure the point. I think, again, social distancing is important and mask wearing is important. The idea that it's farmers markets are outside is a good thing, and we want them to be successful. But there's not differences between you're required to wear a mask on the boardwalk and the social distancing emphasis is the same, so I'm not aware of a difference there.
And then shifting questions, this is from Matt Biddle at Delaware State News. Are there any plans to revamp civil asset forfeiture?
I am not aware. I know there are a whole range of things that we're looking at with respect to law enforcement engagement with communities, particularly communities of color. Use of force guidelines, I think, are near the top of that list. Community training and community policing kinds of techniques. I'm not sure that civil asset forfeiture is related to that, frankly. And I don't remember it being on the list of some of the legislative proposals.
All right, 2 more questions. This one's from Melissa Steele at Cape Gazette. With all the proposed changes in police policy, there has been some mention of transparency. How far will changes in open records and information go? Neighboring states and many others have open government policies that allow public review for information. Will Delaware make changes to allow for more transparency?
I think there will be changes made to transparency. I think there are transparency improvements that we could be made administratively, and we'll be taking a look at that. I think it's important for the public to know within reason, pretty broadly, I would say, the kind of training, the kind of guidelines and rules of the road, if you will, that law enforcement has. I think they, frankly, would have a greater level of comfort if they knew that. If they knew that our Delaware State Police officers had de-escalation training. It was something that I asked Secretary Koop and Colonel McQueen when I was first came in as governor. They had already been doing it, following on with a request by Governor Markell, and continue to do it. I know it's part of their training academy, and I think if there was greater transparency around that training, around their approach to policing, I think there would be a greater level of comfort and confidence, and would improve relationships with communities, particularly communities of color. And so I think transparency is an important part of that. Communication is an important part of that. Understanding is an important part of that. And so, and I know that we have people of goodwill on both sides of that divide, such as it is, where we can make real progress here in our state.
All right, last question from Melissa Steele at Cape Gazette. Since January, the governor's task force has been involved in about 18 raids. Were these no-knock raids, and will the governor's task force continue to conduct raids throughout the state?
So I know that in Delaware, for a no-knock search, that they have to be approved by a judge. And so the local police agency would have to go to the judge and present the case for doing that. I'm also told that it's very rare the governor's task force uses such techniques. But I'm sure it'll be an issue that will be evaluated, as it should be, along with all other use of force techniques as part of the review of these policies and procedures in response to the George Floyd murder in Minneapolis. And again, in part to improve the relationship among law enforcement and between Delaware State Police and the citizens and communities which it serves, and its effort to preserve the public safety and protect the public safety of all Delawareans. I just believe that when people have confidence, and I think most Delawareans do, in law enforcement, then they are better able to do their job and get better results. And so having this conversation, I think, is important. Evaluating all these techniques, I think, are critical to that effort. And with respect to this particular thing, I think already with the protection necessary for it to be approved by a judge as a search, if you will, which is part of a constitutional protection, and the fact that they're not used very often at all, but something that's important to take a look at. So I think that's all with respect to the questions. Again, I want to conclude by thanking Dr. Rattay and her team for their continued work and vigilance, now mostly focused on managing reopening from a public health point of view and identifying those conditions and situations that are problematic and create the potential for a resurgence, a rebound of the virus, and reminding us all that the virus is still out there. There's no effective treatment, and so we need to do everything we can to protect the spread. And AJ, just really impressed by the partnership again, more at a community level now, I think,
Absolutely.
and particularly in Newcastle County, working with the county executive and his teams in public safety, and really ramping up the tests. Over 30,000 midway through this month. We do need to get the message out, get tested, because, as time goes by, and particularly if the health of the community continues to be good and manageable, fewer people are going to, I think, show interest, and that's going to be our challenge, to make sure we can stay ahead of it by getting everyone tested. So be smart, get tested, wash your hands, wear a face covering. I mean, that's really important. I think it's an indication that you care about your neighbor and the community, that you're really focused on cashing in the investment that's been made by so many people on the health of our community, so we can have a strong economy. So thank you all for joining us, and we look forward to seeing you next time.